Well, good afternoon, everybody. My name is Lee Schwartz, and I'd like to welcome you to the second webinar in our 2023 dental series titled Drive Practice Growth with the Top KPIs You Need to Track. And we're excited to bring another year of interesting topics and encourage you to sign up for the other webinars in the series, which I will have more information on towards the end. Now, before we get started, I want to take a second and just say a few words about SVA and our history in the dental industry. Like many of you, we got to where we are by being independent. And our vision moving forward is to remain that way and continue serving the same clients we have since 1974. And a huge part of that client base over these last now almost 50 years, as you can see with our new backgrounds, has been dental practices. Our mindset is that when you're a practice owner or shareholder, you have to work with someone who's more than just an accountant or tax preparer. You need someone who's a true advisor working collaboratively with you. This webinar and others like it are just a couple of small ways in which we can do that. As far as this webinar goes, please send in any questions you may have as we go, but we'll wait till the end to answer them. If you're a client and your question doesn't get answered, we'd encourage you to reach out to your SVA contact. If you're not a client and have questions, please reach out to me or John Armstrong in our business development group, and we'll make sure one of our subject matter experts gets your question answered. Now, we've got two of the most experienced people in our healthcare practice to walk you through everything today. First off, we have Laura Zock, a principal who has worked with dental clients large and small, I think her entire career. And we have Joel Recklich, a senior manager in our healthcare group who works with practice owners and practice managers on efficiency and profitability strategies. All right, so let's jump in. Let's get started. I'm going to kick it off to you first, Laura.
Great. Thank you, Lee, for the warm introduction. And yes, I just had my 20-year anniversary here at SVA and have been working in healthcare for that whole career. So I started when I was 12, Anyways, we're going to kick off our presentation today on dental KPIs. And really, why should we care about dental KPIs? Well, here's how I put that in perspective. Here's our why for the day. Each one of us on this call has our own goals and dreams that we're aspiring to reach. It might be related to business, things we can do in the community, health and wellness, financial. And really, owning and operating a dental clinic is quite rewarding, but it also is a means to help you achieve those goals that you have set for yourself. And SVA wants to be a part of helping you make those goals possible, helping you make your practice what you want it to be and what you need it to be and the best that it can be. I know that might sound a little cliche, but ultimately that's why Joel and I are here today to share with you our thoughts and knowledge on dental industry KPIs with you. For today's webinar, we've put together a number of specific KPIs for the dental industry. We'll discuss how to calculate and measure the results, interpret the results, and also share some strategies with you to improve your practice. First, let's talk in a little more generality about KPIs. Think of KPIs as the metrics that you can put into your practice to help measure and determine the health of your practice, setting targets and determining whether you and your team are meeting them. Ultimately, you want to choose and monitor a few KPIs that support the objectives and goals that you've set for your practice. KPIs are going to be based on your actual practice data. So your practice needs to have accurate and timely information to calculate these KPIs on, so that you can rely on these KPIs and take action on changes in your company if and when needed. KPIs can also give us some insights into your practice in areas such as revenue, costs, efficiencies, and can help you track whether or not you're meeting your goals. For example, perhaps you've set a goal to optimize your hygiene department. How are you going to determine your existing baseline so that you can measure against it, set goals, and evaluate whether you're succeeding? Here comes the hygiene production ratio, and that's one that Joel will be going over with us today. This ratio tells you for each dollar of hygiene wages, how much hygiene was produced. If you're not calculating and tracking this KPI and comparing it to benchmarks, you might not even be aware that there's potential for improvement here. One thing that we want to mention as we get into the meat of this data is that our conversation today is centered around the practice of general dentistry. KPIs and comparable benchmarks are going to differ between general dentistry and other specialty practices such as ortho, endo, perio, pedo, and oral surgery. Today's KPIs are going to be centered around the areas of dental and hygiene production, revenue and various expense categories, and related benchmarks that you can compare to. We're going to go through a couple considerations around decisions on insurance contracts and associates, and then wrap up with what are some trends that we're seeing in KPI and benchmarks in dental practices. We will have a couple audience polls incorporated into our webinar today, and here is the first one. Give us a moment to launch it here. The question is, have you identified specific KPIs to track in your company? I think that's supposed to be your options are 0, 1 to 3, 4 to 5, and 6+. Let's take a moment to answer that KPI, and then I'm going to turn it over to Joel to share with us the results of this poll, and then also start to get into the real data of our presentation today.
Thanks, Laura. All right, well, these KPI questions come in. Just wanted to say good afternoon to everyone. Glad you were able to make it. And we're still waiting on the poll answers. Okay, so there's 11% of you that do not have any KPIs, which is great. I'm glad you're here. 44% of you have 1 to 3 KPIs. Hopefully you can get 1 or 2 additional out of this webinar this afternoon. 22% at 4 to 5 and 22% at 6+. That's great. Keep up that great work. So now as we're looking at production and revenue, we're going to once again look at a single dentist practice. So an average successful practice has 2 hygienists, 2 assistants, and 2 office staff. The office production is going to be 1.3 to 1.4 million. Collections are going to be around 75%, with the collection goal of $1 million. Hygiene production, we're looking at $240,000 to $250,000 per hygienist. The hygiene production ratio is going to be the production by the hygienist divided by their wages. And we want a goal of 3.5 to 1. We recommend also figuring these out on an individual basis to see how each hygienist is doing. If your ratio is below 3.5, you need to look into, are you having broken appointments? What is the length of your appointments? Are you still at 1 hour? Should you consider reducing it to 50 or 45 minutes to see that 1 extra patient? Next, we have the dentist production. On average, it's going to be around $850,000 to $950,000. And a dentist production ratio, which is the dentist production divided by the hygiene production, with a goal of 2.1 to 0. So for easy math, if our hygiene produces $500,000, our dentist will need to produce $1 million to get to that 2 to 1 ratio. Next is our collection to production ratios, which is set up as a percentage. This is how much you collect divided by your total production. Over the past 15 years, we've seen a squeeze. Back in 2008, the collection was at 92%. 5 years ago, it's dropped all the way down to 81. And now we're down to 75%. So being at the 75%, and if you're even lower than that, you could consider implementing a dental membership program. We've successfully helped implement these, and they have a collection rate of over 85%.
All right, I'm going to chime in with a couple of comments here, just taking a step back and thinking overall about what Joel just talked to us about on this slide. When we mention an average practice, he was talking about some numbers. You might be thinking about, where does my practice fall in there? And we work with a lot of dental practices, and so that's where we gain our industry knowledge from. And the focus here is on average. Your practice may be well above those averages based on what you're doing. They might be below those averages, but here's where it's important to know your practice and be able to right size the KPIs or benchmarks or data that we're talking about today. Your practice might be only open 3 days a week based on your current situation. So those types of things are going to obviously affect what some of these ratios are and what these dollar amounts are that are in there. Another comment I want to make is anytime you're looking at a ratio or calculations that are based on production, one thing we often see in the dental practices that we work with is that there's different mentalities around how production is input into their practice management system. Some of you might be recording production at true gross production, or what is the amount on your fee schedule before considering any insurance adjustments or contractual write-offs. Some other practices might be recording their production at net, or what's the fee amount less the insurance adjustment equals the expected reimbursement. And so obviously, depending on what type of production numbers you're using in your system and using to calculate these KPIs and benchmarks, that's going to affect what your resultant KPIs and benchmarks are as well. So a couple of considerations there to think through, particular to this slide, but also as we cover the rest of the topics today.
Next, we'll look at the financial statement formatting and benchmarking. So first and foremost, we want you to have those financial statements set up on a monthly basis. This gives you timely, accurate, and accessible data to measure your KPIs. Next, we're going to look at allocating expenses into sections. So we'll have staffing expenses, which are staff wages, payroll taxes, insurances, retirement, other employee benefits. Then we'll have occupancy, which will include rent. We'll have dental supplies and laboratory. Then we'll have all your other overhead expenses. We would have a section set up for associate compensation, if applicable. And then finally, we'll have the revenue available for professional compensation. So once we have all these different sections set up, next we want you to add another column where you're going to have expenses as a percent of revenue. So as your practice grows, comparing your current activity to a prior month, prior quarter, or prior year might not be the best comparison. You're going to have expenses like dental supplies and laboratory that directly relate to practice revenue. Measuring these as a percentage of revenue will give you a better benchmark than comparing the actual expenses to the prior year. So now we're jumping back into this allocating expenses into sections and then looking at them as a percent of revenue. So your staffing expenses should be around 30-31% of total revenue. Rent will fall in that 6 to 10% range. Dental supplies around 7%. Laboratory will be 3 to 6%, depending on if you have a CEREC machine or not. All your other overhead expenses will be around 15%. Then the revenue available for professional compensation, we have the goal of 35 to 38%. So if you collect that $1 million in revenues, the dentist revenue available should be around $350,000 to $380,000.
And a couple overall comments here on the topic of monthly financial statements. Many of our clients are using software of some sort in order to generate profit and loss statement. QuickBooks is a pretty popular one, right? It might be that in order to make it efficient to look at this data, be able to calculate the KPIs or the benchmarks here, you might need to rearrange your chart of accounts or financial statements. QuickBooks tends to arrange things if you don't have numbers on them in ABC order. So you might have employee expenses scattered throughout your profit and loss statement, or the various components of what truly goes into occupancy costs might be scattered throughout there as well. So oftentimes there's some work we need to do at the front end of this to get your financial data cleaned up to more efficiently and effectively calculate what these KPIs are. Some of the statistics here can also tell you not just how your cost function is doing, but give you other insights into your practice. For example, that supplies category as a percentage of revenue, dental supplies. Joel mentioned it tends to run between 6 to 7% of your revenue. So what do you do if your percentage is lower than that drastically or higher than that drastically? That could be a point to what type of inventory maintenance practices are happening in your purchasing team or your purchasing person within your practice. It might be that you're keeping inventory at levels too low and that you're constantly scrambling for supplies, or it might be that you're keeping inventory levels too high and it's to the point where maybe you could cut back on inventory a little bit. And that 6 to 7% is really a key indicator of some of those things, in addition to just what is the true cost of supplies. Last but not least, when we look at expenses as a percentage of revenue, especially looking at historical trends, it's really key here to make sure we are only using professional revenue to really truly gauge what those percentages are. And if we think back to COVID times and all of the special stimulus that were available then, we had PPP loans that were recorded as revenue until forgiven. We had employee retention credits that counted as income. We had some practices getting HHS provider relief funds. And sometimes when we have those special stimulus, they might inflate or deflate your ratios depending on how you're calculating them. So something important to keep in mind when we're really honing in on calculating these as a percentage of revenue is make sure it's off that professional revenue for comparative purposes.
Those are great points, Laura. Now it's time for our second polling question. Do you feel like your practice has adequate information to set and track KPIs over time? Yes, we revisit our KPIs regularly. Yes, I just need more time to work on my business instead of in my business. No, I don't understand my practice software. No, I don't have confidence in my practice financials. And hopefully not both. I don't understand my software or have confidence in my financials. So I'll wait a few seconds here to get the results. Okay, so it's great to see that 33% of you revisit your KPIs on a regular basis. Keep that up. Looks like 67% of you need to find more time to work on my business instead of in my business. So in that case, I'd recommend trying to delegate some of those tasks that you have, to office staff to maybe give you some more time to work on your business. I'm glad that nobody else said that they don't understand their practice software or financials. So that's a great response there. Now let's look at insurance contract considerations. First, we'll talk about, hey, do I take on a new contract versus do I get rid of a contract? So when taking on a new contract, do you have open chair time? Number for potential patients, how many current patients do you have? What is your maximum capacity? What is the reimbursement rate? How many patients are, could they bring into the practice? And then we're looking at the incremental profit of new contracts. So if you're not at full capacity, you need to look beyond the reimbursement rate. What does that mean? Well, remember, a lot of your expenses are fixed, like rent, utilities, most of your staffing, insurances, those are fixed costs. So those do not go up when you're accepting a new contract. But when you're accepting a new contract, you have some variable costs that will definitely increase, like dental supplies and lab costs. We're looking at that, 13, 14% of your revenues. So if you took on a new contract, that has a low 65% reimbursement rate when you're hoping for 75, you're like, why would I take this on? Well, if you take that 65% and you drop down maybe 15% for the related costs, you're still looking at bringing in 50% of that income for professional compensation. Now, looking at the opposite side, hey, I'm already at full capacity. I don't have any open chair times. I have a super long wait list of, patients that want to come in. Then you start to look at these insurance and contracts and say, which one is my lowest reimbursement rate? How many patients are in this contract? If I get rid of this contract, can I bring in more patients at a higher reimbursement rate? Laura, do you have anything to add?
I do just a couple thoughts. You know, what I love about this is these insurance contract considerations are very specific to where you are in your practice right now and where you want to go. The considerations obviously are different if you're a new startup practice and you're looking to fill your appointments as much as possible, which might be really a different goal than in established practice that's bursting at the seams and can't get their patients in, you know, in the times that they need to. So lots of different considerations, and really it boils down to here, where is your practice at and what are your goals and where do you want to take it to be?
Now let's look at hiring an associate. So, you know, what are your goals? Are you trying to grow the practice? Are you trying to cut back on your hours? Are you looking to transition your practice to a new owner? Overall, you need to make sure your goals are in line with your associates. Factors to consider is growth of practice. I mean, are you at that, you know, 1.4, $1.5 million of production and, you know, still growing? You know, you have 1,800 to 2,000 active patients. I mean, how many new patients are you getting, you know, per month? Is it 15, 25, 50? I mean, do you have a lot of patients on the wait list? You know, these are very, you know, solid considerations when hiring a new associate. Then we're looking at associate compensation. Recently, we're seeing a associate base pay around $150,000. They'll get a production bonus, net collections at around 30%, and that might increase 1% per year that they're there. But in the case of the base pay of $150,000, 30% collection bonus, they would need to collect over $500,000 to earn a bonus. Then we're looking at the associate break-even point. You know, beyond the wages that you're paying them, you also have to look at their payroll taxes, their insurances, education, other professional expenses. You'll even need to hire a new assistant. You have to worry about their wages, taxes, and insurance. So like I said, it's well beyond the base pay of $150,000. Laura, do you have anything to add when hiring an associate?
I do. This is one of the more common questions we get from practices is, you know, when's the right time to hire an associate? How do I go about doing that? How do I know that it's going to be financially the right decision to make? And obviously there's non-financial factors to consider as well. But if I think one of the trying things right now is just the hiring market. Associates are hard to find and practices are busy around here, right? And so if you are a dentist that wants to grow your practice but doesn't want to cut back yourself, you have to consider, you know, what type of space you have in your practice. Can you build more rooms out? Also, what are your new patient trends? You're probably going to need some hefty new patient numbers to build up the practice of an associate if you don't want to turn over any of your patients to them. So there's so many things to consider here, and this is one of those topics that we definitely love to sit down with our clients on and consult on and have a conversation and try to help them figure it out.
All right, Laura, we'll turn it over to you for dental trends.
All right, great. Thank you. Well, we're getting close to wrap up here, so I'll just make a comment if you've got some questions for us that you'd like us to try to answer. We did reserve some time for Q&A, so please think of those and get ready to put them into the Zoom, I guess. But first, we're going to talk a little bit about dental trends and what we're seeing. And one of the big trends we're seeing right now, not a surprise, is increased employee wages, right? Many industries are dealing with, and dental practices, you certainly are no stranger. Given that the large baby boomer generation is continuing to retire in some pretty heavy quantities, and that the stress of COVID times caused a lot of employees to decide to change careers or leave the marketplace or leave the workforce early, we are dealing with a smaller pool of potential employees for everyone to compete for. And with that, as dental practices compete for hygienists, assistants, associates, with that comes higher pay. Obviously, higher pay is a big part of the supply and demand curve with employees. And one way we see this when we're looking at KPIs and benchmarks is that the the cost of employees as a percentage of revenue continues to rise. It's risen by, on average, a couple percentage points over the last couple of years. And that, again, is very practice dependent too. Some practices have had a hard time finding employees. And if it's a hygienist that you're missing, obviously that cuts back on your production capabilities, which then, cuts back on the ability you have to provide dentistry as well, since filling those hygiene chairs has a direct correlation into doctor production. We're also seeing increased dental supply costs. I mean, you've heard the term inflation in the news for quite some time now. As the cost of labor and materials continue to rise, so do the costs to produce and market and distribute dental supplies. And where we see this is when we're looking at that dental supply cost ratio as a percentage of revenue when we're looking at benchmarks and financial statements. Inflation, definitely there was supply chain issues too during COVID. Those have cut back a little bit, but we aren't seeing any decreases to dental supplies these days. As Joel mentioned, we also are seeing reduced reimbursement rates. It still is a best practice to go back and evaluate your fee schedule. We recommend at least on an annual basis. What you want to do is compare to market and bring your fees to market. We need to continue to increase the fees in the dentistry practice because obviously your expenses are rising just like the cost of everything else is. Unfortunately, with how heavy insurance is, particularly in our region here, just because you increase your fees doesn't mean you're going to get an increase in revenue, but we still need to do those fee increases to capture the revenue potential where we can. Maybe it's in some insurance contracts, maybe not all, and also with your patients and your payers as well. And you should be asking the insurances that you're contracted with for raises each year as well. Sometimes the answers might be no, but sometimes the answer might be yes, we can do something. We're also seeing dentists continue to provide a larger range of services. You're all looking at how can you grow and expand your practice and provide more services to help the health and wellness of your patients. Think teledentistry, cosmetic dentistry, sleep dentistry, or expanding into orthodontics or implants. This is something that we continue to see in practice with many practices. And this can be tracked and evaluated within your own practice by looking at your mix of services by dental provider or DPC code. All right, this was a lot of information for us all today. What are our next steps? First step is get to know your data. Is it clear? Is it concise? We want it to be accurate as much as possible. Next step is to evaluate your data. Where are you scoring pluses on your scorecard or minuses and could make room for improvement? Then determine which KPIs you can implement in your practice or improve to measure. Monitoring regularly is really important. As Joel mentioned earlier, we like to see monthly financials, monthly KPIs, monthly benchmarks. You want to identify potential issues sooner rather than later so you can react or be proactive to rectify them. I think it's important to also remember that even small improvements can make a difference. In a $1 million top line revenue producing practice, a 1% increase in your revenue, assuming a 70% collection rate, 75% collection rate, that's another $70,000 to $75,000 of revenue in your practice. Back off your variable expense ratios and the rest is profit for you, the owner. And last but not least, get your trusted advisor involved with this process. You might need their help in compiling the information needed to produce these benchmarks, track the KPIs, and help coach you along the way. All right, Lee, I didn't leave you much time. I'm sorry. I'll kick it back to you for Q&A and wrap up.
No, that's good. Nobody wants to hear from me anyway. So no, great job, Joel and Laura. So much information to cover. As always, every time we do this, I feel like we could do this for a couple hours, but we want to be sensitive to the time that people are available as well. So I've seen that a couple questions have come in. We'll go a couple minutes long. So if you have any additional questions, please chat them in. I think the first question that I wanted to ask you guys is, the first poll question is, how many KPIs do you track? How many is too many, and where do you feel like the sweet spot is for how many KPIs people should be tracking?
My answer is it depends. I think that if you are a practice that's not looking at KPIs, don't expect to go to 0 to 60 in 3.2 seconds. I would suggest you start off with a couple and really look at your financial data first to figure out where you feel like you could make the most improvement or change. But often I would say, like, in practices that have been doing this for a while, it's not uncommon to have at least like maybe 6 to 10 that you're tracking on. I mean, if you look at the different categories of the KPIs, you probably want at least a couple in each area if you can.
Okay, thanks. Yeah, that's good, because there can definitely be paralysis by analysis as well that you want to stay away from. So one of the questions that came in, guys, was what fee raise percentage would you recommend and what factors to consider in raising those fees?
A couple of factors I look at. I thought Laura did a great job of covering it earlier. Was looking at, maybe the increase in your staffing expenses. You could look at the increase in maybe dental supplies, lab fees. You could also look at just like the consumer price index as that goes up to increase your rates. And just revisit, like she said, every year, make sure they're comparable to your competitors.
And at the risk of getting ahead of ourselves, this will be a shout out for next month's webinar, which is where we're revealing the results of the dental salary and benefit survey, because there was a question there about we asked the practices how much they raised their fees. So we'll have all that information if you want to jump back on next month. Another question that came in was when you calculate your hygiene ratio of production to salary, do you use benefits? Do you use gross or net production?
We're using gross production, and we're just using this wages, salaries that are being paid to the hygienist to calculate that 3.5. When we see very successful practices, at 4.2 in terms of that ratio, like I said, if it's under the 3.5, you just need to dig into the details a little more.
Yeah, those ratios 4 and up, those might be indicators or resultant of shorter hygiene check appointments. And if you have net production instead of gross hygiene production, then that, from a math perspective, decreases your numerator and will make that ratio higher than if it were gross as well. So here's where you just need to know your numbers and make adjustments compared to benchmarks, and also know what's included in the benchmarks.
Okay, great. And I see a couple of other very specific questions have come in. We can reach out to those folks directly. I don't know that it applies to everybody, but so let's wrap it up here. We want to be respectful of everybody's time. Thanks all for jumping on. As we wrap up, I just want to point you all towards sva.com/dental series to sign up for the other webinars in the series. And you can also find news and information that may affect your business. Our next one, as I mentioned, is November 14th. And that's when we're going to be revealing the results of our 3rd annual dental salary and benefit survey. So definitely one you're going to want to sign up for. Having seen some of that data, really interesting stuff. And especially taking a look at that information over these last few years, really helpful to practices. So I just want to remind everybody that the SVA team is only a phone call or an email away. So if you're a client, reach out to your SVA professional as questions arise. And if you're not currently an SVA client, you can contact me or anyone in our business development group so we can get you the help or the answers that you need. Thanks for attending today, and hope you enjoy the rest of your afternoon. Hope to see you next month.
All right, thanks all.